Welcome to the Healthcare Motivation Channel, your dedicated space for inspiration, support, and practical wisdom tailored for every healthcare professional and caregiver. If you find value here, please click like and subscribe so you never miss an uplifting message. And remember to share this video with a colleague or caregiver who could use an encouraging word today. Together, we can lift each other up and strengthen our community of care. Today's topic is Your Patients Depend on You. Hello to all the dedicated healthcare professionals and caregivers tuning in today. Whether you're a doctor, nurse, paramedic, technician, therapist, home caregiver, or anyone working at the front lines or behind the scenes, this message is for you. Every day, patients place their trust, their hopes, and often their very lives in your hands. They depend on your expertise, your vigilance, and your compassion. According to the Institute of Medicine, delivering high-quality care means being safe, effective, patient-centered, timely, efficient, and equitable. These aren't just ideals, they are the expectations your patients have and the standards you uphold. But let's be honest, the responsibility is immense, the stakes are high, and the pressure can feel relentless. Yet, it's precisely because of this responsibility that your role is so vital. Your patients depend on you, not just for your knowledge and skills, but for your resilience. Be committed to enhancing their well-being. Stay positive and finish the mission. In healthcare, circumstances are often unpredictable. Emergencies, resource limitations, and emotional challenges are part of the landscape. Research shows that positivity isn't just a feel-good strategy. Positivity is a protective factor against burnout and emotional exhaustion. For example, a recent randomized controlled trial found that targeted interventions to boost well-being led to a 17% reduction in emotional exhaustion among healthcare workers. The study also showed improvements in emotional thriving and work-life integration. Staying positive does not mean to ignore difficulties. Staying positive means creating a laser focus on your mission. Staying positive means focusing on those action steps to care for your patients regardless of the obstacles. Staying positive means finding meaning in your work. Even on those challenging days, remember that every act of care makes a difference to your patient. The source of your strength, knowledge, skills, and networks. Your knowledge and skills are your foundation. But where do they come from? They are built through rigorous education, continuous learning, and crucially through collaboration with colleagues and participation in professional organizations. The National Academy of Medicine emphasizes the need for all healthcare professionals to work in interdisciplinary teams, employ evidence-based practice, and continuously seek quality improvement. Building a strong professional network isn't just about sharing information, it's about mutual support. Studies show that healthcare professionals who are connected to robust support networks experience better teamwork, improved care coordination, and greater resilience in the face of stress. These networks help break down barriers, foster collective expertise, and create a sense of belonging, key ingredients for both professional growth and patient safety. Understanding occupational stress, the middle range theory. Let's talk about stress not as an enemy, but as a reality that can be understood and managed. The middle range theory of occupational stress in health professionals, or MRT-OSHP, offers a powerful framework for this. Developed using the Betty Newman systems model, this theory identifies 3 types of stressors. Intrapersonal stressors, which are internal conflicts such as role identity issues or low professional experience. Interpersonal stressors, which are challenges in relationships, social support, and work-life balance. And extrapersonal stressors, which are environmental factors including workload, staffing, communication breakdowns, and exposure to trauma or infection. The theory emphasizes that stress is not a disease, but a human response to these stressors. When healthcare professionals have strong protective factors such as resilience, social support, and effective coping strategies, they are more likely to maintain their mental health and stability even in high-pressure environments. Conversely, negative responses to stressors can lead to impaired quality of life, dissatisfaction at work, and symptoms of depression. The MRT-OSHP underscores the importance of both individual and organizational interventions. Healthcare professionals play a crucial role in identifying stress responses and implementing primary, secondary, and tertiary prevention strategies to enhance mental health and reduce complications. Actionable, evidence-based strategies. So, how can you turn these insights into action? Here are high-impact, research-backed strategies. Engage in positive psychology interventions, or PPIs. A recent study showed that healthcare workers who participated in a 21-day positive psychology program experienced improvements in happiness and reductions in burnout up to 18 months later. Participate in resilience training. Systematic reviews confirm that interventions like mindfulness, psychoeducation, and stress management significantly boost resilience and psychological well-being across diverse healthcare settings. Build and maintain support networks. Actively seek out or create communities of practice, peer support groups, or professional organization memberships. These networks foster collaboration, knowledge sharing, and emotional support, all of which are linked to better patient outcomes and professional satisfaction. Advocate for organizational support. Perceived organizational support is a strong predictor of work-family enrichment and job satisfaction among nurses and other healthcare workers. Advocate for policies and leadership practices that prioritize staff well-being, open communication, and adequate resources. Use self-reflective practices to identify stressors and reframe challenges as opportunities for growth. This mindset shift is foundational to resilience and long-term success. Challenging assumptions and inspiring growth. Let's challenge the assumption that stress is simply the cost of caring. Instead, see it as a signal, a prompt to connect, to innovate, and to grow. Ask yourself, how can I use today's challenges to become a stronger, more compassionate professional? What support systems can I build or strengthen within my team or specialty? How can I contribute to a culture of resilience and excellence in my workplace? In conclusion, your patients depend on you, and you are not alone. Remember, your patients depend on you, not just for your technical skills, but for your humanity, your teamwork, and your resilience. By investing in your own well-being, building strong professional networks, and embracing evidence-based strategies, you are not only caring for yourself, but also ensuring the best possible outcomes for those who rely on you. Stay positive. Stay connected. You are never alone in this mission. Together, we can transform the challenges of healthcare into opportunities for growth, strength, and lasting impact. Thank you for joining us on the Healthcare Motivation Channel. If today's message inspired you, don't forget to click like, subscribe, and share this video with a fellow colleague or caregiver. Your encouragement could be the boost that someone needs to feel supported and to keep going strong in their mission to care for others. Stay motivated, stay connected, and we'll see you in the next video.